In this lecture, we will discuss the leads, specifically the two lead systems and how they combine to give us the standard 12 leads on the EKG. There are 12 leads that make up the standard EKG, and it is composed of two lead systems that we will discuss, the hexaxial system and the precordial system. The hexaxial system is made up of 6 limb or extremity leads, and the precordial system is made up of 6 precordial or chest leads. Let's start off with the hexaxial system. So the hexaxial system is a coronal cut that provides a frontal view of the heart. We often refer to this as the frontal plane. The 6 limb leads that make up the system are leads 1, 2, 3, AVR, AVL, and AVF. So if you look here, we can see those 6 limb leads, okay? And notice they're going from here, the right arm, to the left arm is lead 1, okay? We're going from the right arm to the left leg is lead 2, and from the left arm to the left leg is lead 3, okay? So these are the 3 main limb leads. We also mentioned that there's augmented leads, okay? And these are leads AVR, which is here, AVL, which is there, and AVF, okay? And notice here's 1, 2, and 3. Now each lead is separated by 30 degrees, these limb leads. And this is because if you take a circle with 360 degrees and then divide it by the 6 limb leads, this gives us 30 degrees between each lead and the frontal plane. So if you look here, here's lead 1, and then we have lead AVL, okay, and notice there's 30 degrees between it. Here's 1, okay, and 30 degrees between that would be AVR, which is here. This is the negative end of AVR, and this would be the positive end, okay? And one thing to note, and we'll discuss this in a little bit, is that we name the leads with the positive end getting the name. So if you see lead 1, here's the positive end, AVL, its positive end, 2, AVF is positive, and 3, and AVR. Okay, so wherever you see that positive end, that's how we name these systems. Now the second system is called the precordial system, which is a sagittal cut that provides a horizontal view of the heart and consists of 6 precordial leads, and these leads are perpendicular to the limb leads. The 6 precordial leads are V1, V2, V3, V4, V5, and V6. So V1 through V6 are precordial leads. They move from right to left across the precordium. Okay, so here we have our precordial leads, okay, V1, V2, V3, V4, V5, and V6, and you could see them here, all right, moving from right to the left side, okay, these are our limb leads that you notice here, okay, so we're going from the right side and moving across the chest to the left side of the heart, and so these are the 6 precordial leads, okay? Now the right precordial leads are considered leads V1 and V2, and these are the ones that are closest to the right side of the heart, so the right atrium and right ventricle, okay? So we're saying here's V1 and V2, notice it sits right over the right ventricle, okay? And that would be this lead and this one here, okay, over the right side of the heart, and here you can also see it, V1 and V2 over that right side of the heart. And then we have the left precordial leads, and these are considered leads V5 and V6, and these are the ones that are closest to the lateral wall of the left ventricle. Okay, so we have V5 and V6 on the left side of the heart. Here's our left ventricle right here, and you can see how those are sitting there. So notice we go from the right side to the left side, okay, across the precordium from V1 to V6. Now something different from the limb leads is that these precordial leads are spaced out by 20 degrees. Okay, so if you look here, the distance between these is all 20 degrees. Okay, whereas we said everything here in the frontal plane is 30 degrees apart. So that's one difference. And the other thing we pointed out was, again, every side, so where we see this V1 and all these leads, that is the positive end of each of these leads. Okay, if you look here, the positive is how we name these. So the positive AVL gets the name, the positive end of AVR is where that gets its name as well. So the standard 12 lead EKG combines with these two lead systems, and if you can imagine them, they sit right over the top, and we can see that in this image here, okay, where we have both lead systems where we're taking the limb system, okay, or this hexaxial system, hex meaning 6, and we're taking it and putting it on this, and we're taking also these precordial leads and we're putting them on top of the heart, okay, placing them right at the center, and we have both of these going on, okay. The limb leads, here's lead 1, 2, AVF, 3, AVR, and AVL, okay, and then we have our precordial leads going from the right side to the left side, starting from V1 and going up to V6. So those are the standard 12 leads on the EKG. So where would we see changes on the EKG if you had a problem in the inferior portion of the heart? Okay, so the inferior portion would be down here. So what leads are down there? Okay, so that would be lead 3, AVF, and 2. Okay, so we consider the inferior leads 2, 3, and AVF. So certain changes in these leads would point to possibly an inferior wall MI or ischemia in that region. What about leads V1 and V2? Well, these leads run along the septum, and therefore changes in these leads may indicate a septal wall MI. Okay, here's lead V1 and V2. We can see them better in these leads, and they're going right over the septum, and these are usually called the septal leads. So if you see any, ST elevation in these leads, we may, think of a septal MI. Now, how about something a little harder? What if you had changes in leads 1 AVL, V3, V4, V5, and V6? Well, let's look at this. V3 and V4 make up the most anterior leads, and leads 1, AVL, V5, and 6 make up the lateral leads. Therefore, ischemic changes on the EKG in these leads may indicate an anterolateral MI. Okay, so let's look at that. So again, the leads that we're talking about here are 1, AVL, V3, V4, V5, and V6. Okay, so where are V3 and V4? They're right here over the anterior portion of the heart, and then we have also 1 in AVL. Here's AVL, and here's 1, and then V5 and V6 are also here. So we call that, here's the anterior portion, and then these make up the lateral portion, so we would call that an anterolateral MI. Okay, if we had ST elevation in those leads, we would consider that an infarct in that region. Hopefully this is start to make sense. Now what we'll see is that these concepts are really important as we move on, and it should become second nature as we continue to get more practice. So let's briefly review what we discussed before we end. So these leads, the standard 12-lead EKG is made up of 12 leads, right? 10 electrodes. It's a 2-lead system. We have the hexaxial that has 6 limb leads, 1, 2, 3, AVR, AVL, and AVR, okay? Then we have the precordial leads that's made up of 6 precordial or chest leads, okay? That's V1 through V6, and it goes from the right side to the left side of the precordium. The hexaxial leads, the limb leads, are separated by 30 degrees, representing the frontal plane, whereas the precordial leads are separated by 20 degrees and represent the horizontal plane. Well, that's the end of this lecture. We discussed leads, specifically the 2-lead systems, and how they combine to give us the standard 12 leads on the EKG. I hope you learned something.